Make the ground shake.
Hyperemia of the pulp clinic, diagnostic, differential diagnostic and treatment. The plan of lecture. First, caries of dentin of medium caries, and the second, hyperemia of the pulp or deep caries. First, about classification and exactly about definition of caries. Caries is a localized pathological process that occurs after the eruption of the tooth under the influence of microorganisms characterized by the demineralization of calcified tooth tissue and the disintegration of the organic matrix followed by cavity formation. There is classification of dental caries according to clinical topographical. First, the initial caries, second, superficial caries, third, medium caries, and the last one, deep caries. Another classification is according to World Health Organization or International Classification of Disease. All forms of caries are classified as a K02. K02 is dental caries, K02.0 caries limited to enamel or white spot lesion, initial caries, K02.1 caries of dentin, K02.2 caries of cementum, and K02.3 arrested dental caries. Caries of dentin or medium caries corresponds to the code K02.1 and its name caries or dentin according to International Classification of Disease, and according to clinical topographical classification it is medium caries. Histologically there are two cones, first cone in enamel and the second cone in dentin, and the process spreads along the enamel dentin border between enamel and dentin. According to Silverstone, there are several pathomorphological zones. First, zone of decay, second, microbial avant-garde zone, next, demineralization zone, fourth, sclerosed dentin, next, intermediate, and the last one, substitutive dentin. There are two types of course of dental caries. First type is chronic course of caries and the second is acute course of caries. During chronic course of caries there are complaints, maybe they are typical. In the tooth we can see white entrance opening. The cavity is filled with a small amount of dense pigmented dentin. Dentin is pigmented, dentin is dent, and there are small amount of dentin. During acute course of caries, complaints are not typical. There are no complaints. We can see narrow entrance hole. The cavity is filled with a large amount of light dentin. Dentin may be light, soft, and there are a large amount of it. Pathomorphologically, in the acute course of caries, there are no zone of sclerosis and no zone of substitutive dentin. Clinical manifestation of medium caries. We apply both basic methods of diagnostic and additional methods of diagnostic, results of basic methods of diagnostic. As for complaints, there are several options. First, no complaints. Next, maybe pain from chemical, less often from temperature irritants due to hydrodynamic theory. And the third option of complaints is aesthetic defect. As for inspection, we can find discoloration of the affected area, presence of caries cavity, and localization of defect. During probing, we found painful on the enamel dentin border, and percussion is painless. Results of additional methods of diagnostic. During temperature test, it is painful and short-term. In X-ray picture we can see K3 type of cavity, and electroodontal diagnostic gives us result of electricity from 2 till 10 microampere in frontal teeth and from 7 till 20 microampere in posterior teeth. Differential diagnosis of medium caries provide with 4 diseases. First, it is superficial caries. Difference between medium caries and superficial caries is cavity in enamel. During superficial caries, cavity localized in enamel. Second differential diagnosis is deep caries. During deep caries, there are more complaints. Probing also different. Probing will be painful all over the bottom during deep caries. In medium caries, probing is painful in enamel dentin border. Also different electroodontal diagnosis parameters. They are higher during deep caries than during medium caries. And in X-ray picture we can see K4 type of caries cavity in deep caries, and in medium caries there will be K3 type. The third disease is chronic periodontitis. During chronic periodontitis, electroodontal diagnosis will be more than 100 microampere, and also we can find different changes in periapical tissue in X-ray picture. In medium caries, only K3 defect in the hard tissue of teeth, no changes in periapical tissue. And the last one, wedge-shaped defect. And the main difference between wedge-shaped defect and medium caries is the shape of cavity. During wedge-shaped defect, it will be like a wedge. Treatment plan of medium caries. We have to treat medium caries using preparation and filling. First, anesthesia, different anesthesia depending on the teeth, depending on the jaw and teeth. Next, preparation of the caries cavity to a dense light bottom. Next, antiseptic treatment using different antiseptic. Next, drying. Next, if needs, insulating gaskets. If we use cement, filling. this stage may be skipped if we use composites, light cueing composites. If we fill cavity with light cueing composites, insulating gaskets doesn't need, and permanent seal depending on class. As for stages of preparation of the caries cavity, there are 5 stages according to Bigelman. First stage is disclosure of cavity. Second, preventative expansion, creating an external form. Third, necroectomy. Fourth, the formation of cavity. It should be stable, retentive form. And the last one is finishing of the edges of enamel. And depending on classes of caries cavity, we choose filling material. And as for selection of filling material, during first class we may use silicon phosphate cement, glass ionomer cement, amalgam, composites and compomers. During class 2, the same material plus silicon phosphate cement. Class number 3, silicate cement, glass ionomer, composites and compomers. Class number 4, composites, and class number 5 we choose glass ionomer cement, composites and compomers. Next part of lecture is deep caries or hyperemia of pulp. This name, deep caries, is according to clinical topographical classification and according to International Classification of Disease, it corresponds to the code K04.00 and it is called initial pulpitis. It is different code. It is not caries because of changes in the pulp, and according to International Classification it corresponds to pulpitis and calls initial pulpitis K04.00. But according to the clinical topographical classification it is deep caries. According to Silverstone, there are the same pathomorphological zones like in medium caries: decay, microbial avant-garde, demineralization, sclerosed dentin, intermediate, substitutive dentin, but more pronounced changes in the pulp due to depth of the cavity. Caries cavity is deep, so first changes start in the pulp. Clinical manifestation of deep caries. Also, there are basic methods and additional methods. During basic methods, we collect complaints, and there are 3 options of complaints. First, there are no complaints. Second, there may be pain, more often from temperature and less often from chemical irritants due to vasospasm. And the third option is aesthetic defect. During inspection, we may see discoloration of the affected area, presence of caries cavity, and localization of defect. In probing we can find that it is painful all over the bottom of the caries cavity. The whole bottom is painful and percussion is painless. As for additional methods of diagnostic, there are temperature tests. It's also painful but short-term, like in medium caries. In X-ray picture, there is K4 type of cavity, and electro-odonto diagnostic parameters, they may be higher than in the norm. In frontal teeth, there are from 2 till 15 microamperes, and in posterior teeth there is 7 till 25 microamperes. Differential diagnosis of deep caries provide with 3 diseases. First, medium caries. Second, acute focal pulpitis, and the third one, chronic fibrous pulpitis. 1 caries and 2 form of pulpitis. And in detail you can see differential diagnosis in the table. Our disease, deep caries, and 3 differential diagnosis disease: medium caries, acute focal pulpitis, and chronic fibrous pulpitis. And there is sign: pain during deep caries. It is causal and short term. In medium caries, the same, causal and short term. And in pulpitis, there is spontaneous and long term. And in chronic fibrous pulpitis, causal and long term. It's difference in pain. Deep caries causal short term, and pulpitis, it is different. As for the depth of cavity, in deep caries it's deep, in medium it's medium, and both in acute focal pulpitis and in chronic fibrous pulpitis it's also deep. Probing in deep caries, it is painful all over the bottom. In medium caries, it's painful on enamel dentin border. In acute focal pulpitis, it is painful only in one point of the bottom, which is closest on the pulp, to the pulp. And in chronic fibrous pulpitis, it is painful in one but opened point of the bottom. Temperature test. In deep caries it's short term, and also it's short term in medium caries, but it is long term in pulpitis, in acute focal pulpitis, and also in chronic fibrous pulpitis. As for electro-odonto diagnostic, in deep caries it may be till 20 points, whereas in medium caries it is like in norm tooth, from 2 till 10 microamperes. And as for pulpitis, the parameters are higher, till 25 in acute focal pulpitis and from 25 till 40 during chronic fibrous pulpitis. X-ray picture gives us K4 cavity in deep caries, K3 in medium caries, and it may be K4 or K5 cavity in acute local pulpitis, and K5 cavity in chronic fibrous pulpitis. As for the treatment of deep caries, there are two options. We may treat deep caries in one visit, but bottom should be dense, light or pigmented, or in two visits. The bottom may be with areas of softening. Treatment of deep caries in one visit. We provide anesthesia, the next dissection of caries cavity till dense, light or pigmented bottom. Next, antiseptic treatment, drying, and apply therapeutic or sub-basic gaskets. Next, insulating gaskets, zinc phosphate or polycarboxylate or glass ionomer cement, and the last one, permanent filling. There are three types of treatment lining or pads, and it depends on the mechanism of action. First type is odontotrophic, contributing to the formation of substitution of dentin and contain the preparation of calcium. The second type is biological. It has antimicrobial and anti-inflammatory action. And the third type is combined, which has antibacterial, anti-inflammatory and also plastic modifies properties like odontotrophic. Mechanism of action of calcium hydroxide. Calcium hydroxide is a strong alkali with a pH of 10 till 12 points. At the site of application, there is necrosis in the pulp. Next, the pulp is impregnated with calcium salt from the bloodstream, and dentin tubes are sealed, and odontoblasts form a matrix of substitutive dentin. Materials containing calcium hydroxide is produced in different drugs form. Aqueous suspension of calcium hydroxide may be powder and water. They ovulate only under a temporary seal no more than 1 or 1.5 months. Next, calcium salicylate cement like Life, Dical, Calcimol and others. They are used under a permanent seal and represented by a paste-paste system. Two pastes which are mixed and applied on the bottom of the caries cavity, and light curing of polymeric materials containing calcium hydroxide. They added a light curing polymer resin, and they are durable and can be used under a permanent seal without an insulating gaskets. Just this paste, next light and next adhesive system and filling. The representatives Septocal LC by Septodont and Calcimol LC by Roca Light Curing LC. Biological and combined therapeutic pads contain corticosteroids, salicylates, antiseptics, chlorhexidine, sodium hypochlorite, antibiotics like metronidazole and polymyxin, different enzymes like trypsin, hematrypsin. They overlay on the entire bottom of the cavity for a short time. Willing to combination medical pads. They are pulpamycin, pulpanest, pulperil, pulpavital. Mechanically fragile, not hardened. They are replaced by calcium-containing zinc eugenol cements. By the mechanism of curing, therapeutical pads may be chemically cured, and there are two components: basic paste and catalytic pastes. They have high bacteriostatic effect due to high pH from 10 till 12 points, and they don't form micropores. And the second mechanism is light curing. They are one component paste. They have good adhesion to the composite through the polymeric matrix and high compression and transparency. As for disadvantages of therapeutic pads, there may be the formation of denticle and petrificates, which leads to obliteration of the tooth cavity. There may be formation of denticle and petrificates. Next option of deep caries treatment in 2 visits. During first time of patient, we provide anesthesia, maximum necrectomy, anti-inflammatory and antimicrobial drug using biological or combined therapeutic pads for several days, from 2 till 7 days under the temporary filling. The most point is temporary filling, and during the second visit we remove on temporary seal, provide antiseptic treatment, point odontotherapy drug, therapeutical drug. Next, insulated gaskets and permanent filling. In second visit we may fill cavity using permanent filling. The imposition of calcium-containing therapeutical pads is pointwise in the projection of the pulp horn in one point close to the pulp horn. It will be enough, only point. Another option which will be provided in 2 visits. In first visit, incomplete necrectomy. Next, odontotherapy, the drug for several months, from 1 till 6 months, and also temporary filling. And in 1 from 6 months, during first visit, we provide electroodonto-diagnosis. If it's in the norm, we continue treatment of deep caries, providing anesthesia, complete necrectomy, point odontotherapy drug, insulating gaskets and permanent filling. Difference in the duration of this odontotherapy. In first option it will be several days, in second option it is about from 1 till 6 months till half a year. And the lecture is over. Thank you for attention.